Chapter 36, Thrombosis and Genetics, as specific training for counseling for the Thrombo sensor. Now you will find the Thrombo sensor here, and it has two different functions. For one, prevention of developing thrombosis. It's not particularly helpful in early diagnosis when a thrombosis occurs, so it really not much of a benefit here. But again, treatment can be improved with the Thrombo sensor. And now let me explain the concept of thrombosis. If we look at the cross-section of skin here, so we've got the skin surface, we've got the blood vessels and blood platelets, which are kind of like the mortar for building blood clots. And if we look at the different genes and proteins that are active in blood, there is the factor V gene. And this gene produces factor V protein. A gene is always instruction of how to build a protein. So we've got the protein here, and this is built in a way that is still inactive. So we've got the factor V protein that is inactive, and it's floating around in blood. Then there's another gene called prothrombin, and this builds a protein as well, which is also inactive. So these two genes produce their proteins, and they are inactive and float around in blood. Now each of these genes produces a lot of these proteins, which are all inactive. And now we have this person, he stepped on a nail. And this nail ruptured some blood vessels and some tissues. And then let's have a look what happens here. When you pull out the nail, the following occurs. This stress to the cells or to the tissue is recognized. And then first factor V protein is activated. So this long chain is cut open and it is combined to look like this. And there's a small molecule in there combining the two and holding them together. Now this factor V, which has now been activated, then has an activating function on the prothrombin, and this is then activated. And this again, when it is active, causes more factor V to be activated. So really you get this kind of circle. Once this is activated, it activates prothrombin, and then more and more and more is activated. So it's a kind of positive feedback mechanism. So this leads to lots of factor V being activated and lots of prothrombin being activated. And in a simplified manner, the prothrombin then indirectly causes the platelets to bind together, and then it produces a blood clot to close up the wound, which is what you want to do, otherwise you would bleed to death. And this usually happens quite quickly in people with normal genes in this case. So this is the normal process that you would want to have happen. Now, the wound is closed up, the body recognizes, okay, it's enough, we don't need this function anymore, and then there's a protein, an APC protein, it's kind of like an enzyme, which degrades the active factor V. So it eats it up, and in the end you don't have any factor V left. This causes, this makes sure that no more prothrombin is activated. It is also lost, and then in the end you get back to the normal state. The wound heals. So this is what happens normally when you hurt yourself. The wound heals, and then everything is back to normal. Now let's look at the genetic variations. If a person has a genetic variation in the factor V gene, and the same process happens, what happens is the factor V protein is built in a slightly different way. So it's not as expected, constructed as expected, but it has this modification here. And now the factor V protein with all of these errors is floating around, and the prothrombin in this case is normal. Now again you get the tissue being damaged, and then the factor V is activated just as before. And that then activates prothrombin, and this is the cycle, and it produces a lot more activated factor V and a lot more activated prothrombin, which then closes up the wound. So far so good, so far it's still all the same. But once this has been done, the tissue says, okay, it's enough, we now want to break down the factor V again. And then the APC comes along, but this factor V molecule is quite resistant to breakdown. So it resists being broken down, and it has this tendency to cause more blood clots to be formed. And this is the real problem, because in some cases, even when there's no damage to the tissue, these blood clots can form because factor V is just so potent in creating blood clots and so resistant in being broken down to avoid this, that it can cause blood clots, and they then block up some blood vessels, and then they restrict blood supply to parts of the brain or somewhere else. And this is then a severe and sometimes deadly situation. And if it happens in your legs, for example, it's called a thrombosis. If it happens in the brain, it's a stroke. It can be a heart attack if it blocks up in the heart, or pulmonary embolism if it blocks up the blood supply to the lungs. And many of these are very dangerous occurrences. So what we can tell when we test the relevant genes, we know that if the factor V gene has a thrombosis, the risk is 8 to 80-fold increased compared to a person with no genetic risk. Then if the prothrombin gene has a genetic variation, it's 5 to 25 times increased risk. And then there's another gene, and these two cause venous thrombosis, so thrombosis in the veins, in the blood vessels that go back to the heart. And arterial thrombosis, these are the blood vessels that go away from the heart. There's a genetic variation that increases the risk 1.84 times. So there are some, that's a genetic risk. And there are a number of risk factors that especially people with increased risk should avoid to not increase the risk more and even reduce the risk compared to other people with the same genetics. So there's something called the economy class syndrome, because people sitting in a plane for 10 hours have an increased occurrence in venous thrombosis. So they sit for 10 hours, it causes blood clots to form in their legs, and this can then cause thrombosis maybe even the day after. So 10 hours of sitting in a plane is a risk factor. That's why some people should take blood thinners if they have a high genetic risk when they're on planes. Smoking increases your risk 1.52-fold, so it should, especially in genetically predisposed people, be avoided. Then after surgery, or when you're lying in bed, in a hospital bed for some weeks maybe, this is also a very strong increased risk. So also blood thinning should be taken during that time. And in women only, hormonal preparations like the contraceptive pill or hormone replacement therapy by themselves increase the thrombosis risk ×2. But in combination with a genetic variation, it's ×15. So these risks multiply each other and become very, very significant. So hormonal preparations or hormonal drugs should really be avoided if possible, or combined with a blood thinning therapy. And also for women in pregnancy, generally they have a 4 times higher risk of developing a thrombosis compared to non-pregnant women. If combined with a genetic variation, it's a 60-fold risk. So it's a very, very high risk, and these women should be treated with heparin to protect mother and child from this dangerous concept. There's more information about the hormonal therapies and pregnancy in another training, and this is supposed to show the concept of how thrombosis is generated and what we can tell from a genetic test. That's the end of chapter 36, Thrombosis and Genetics.